Hello! Welcome back to the Medcurity podcast. Today we're going to talk about zero trust in healthcare, what it is, why it's a game changer for protecting patient data, and how to get started without turning your organization upside down. Now this is a big piece of our cybersecurity puzzle, and we'll walk you through it step by step to keep your systems secure and compliant. Let's start with the basics. Zero trust is a security approach that says, don't trust anyone automatically. Whether this is a doctor logging in from the hospital or a device connected to your network, zero trust assumes nothing is safe until it's verified, every time. In healthcare, this means checking users and devices constantly to make sure that only the right people get to access patient information, like medical records or billing details. It's a shift from the old way of thinking, where once someone was inside the network, they were good to go. With cyber threats growing, that just doesn't cut it anymore. So how does this work in practice? It starts with strong identity checks. Think multi-factor authentication, where you need more than just your password to get in. Then you break your network up into smaller pieces so that if someone does sneak through, they can't just roam freely. Devices like those fancy new medical gadgets get scanned to make sure that they're not compromised before they connect. And all of this happens in real time with monitoring tools keeping an eye out for anything suspicious. It's about building layers of protection around your data, not just a wall around the outside. Now, what kind of threats are we talking about? In healthcare, we're up against ransomware that can shut down entire hospitals, insider slip-ups where staff accidentally open the wrong email, and even sneaky outsiders that come in and pretend to be legit users. Zero trust tackles all of these by making sure that every move is checked. It's not about trusting your team less, it's about knowing that the bad guys are always looking for a weak spot. And with patient data being worth a fortune on the black market, those weak spots can cost you big time while they make the bad guys very wealthy. Compliance is a huge part of this too. HIPAA says that you have got to keep patient information safe with technical safeguards, and zero trust fits right into this. The National Institute of Standards and Technology has a guide called SP 800-207 that lays out how to do this, pushing for constant verification and limited access. It's not a rule that you're going to get fined for skipping, but it's a roadmap that lines up with what regulators expect. Plus, if an auditor comes knocking, showing that you have zero trust in place can prove that you're serious about security. To give you a sense of why this matters, let's look at a real-world example. Back in 2020, a ransomware attack hit a hospital in Germany. It locked up systems, forced staff to turn away patients, and even led to a patient's death when emergency care got delayed. The attacker got in through a weak point and spread fast because the network trusted too much. If zero trust had been in play, checking every device and user, keeping systems separate, the damage might have been stopped early. No fine was tied to this case, but the cost in trust and lives was steep. Compare that to a breach in 2021 at a US healthcare system, where tighter controls caught a threat before it spread, showing how this approach can work. These are the stakes we're dealing with. The average data breach in healthcare costs over $10 million these days, according to recent reports, and ransomware is only getting worse. Zero trust isn't a magic fix, but it's a solid way to shrink those risks. It's like locking every door in your house, not just the front one. It takes more effort, but it's a lot harder for someone to break in. So how can you make this happen without hurting ongoing operations? First, set a clear plan. Map out what needs protecting most, patient records, medical devices, billing systems, and decide who gets access. Make sure that everyone's on the same page, and next, train your team. Show them how to use multi-factor authentication and how to spot weird activity. Make it part of their routine. They don't need to be tech wizards, just aware. Technology helps a lot here. Get tools that check identities and monitor traffic. Think of it like a security guard who never sleeps. Start small if you need to, maybe just one department. Test it out without disrupting patient care. Keep an eye on deadlines, like setting up alerts to review access logs weekly. And check in regularly. Do a quick audit every few months to see what's working. Stay in the loop on new threats too. Industry updates or a quick scan of official sources can keep you sharp. Let's compare this to the old way. Traditional security trusted everyone inside the network, like leaving your back door unlocked because the front one's bolted. Zero trust locks every door and checks IDs at each one. Organizations using zero trust, like that US system that I mentioned earlier, have a better shot at stopping trouble early. This isn't just to avoid fines, remember, it's about keeping care running smoothly. Patients trust you with their data, and a breach can shake that. Plus, with more staff working remotely and devices connected everywhere, the old perimeter is gone. Zero Trust steps up to cover that gap, tying right into your broader cybersecurity. Weak spots in access can be weak spots for hackers. Fixing one helps the other. Now here's our wrap up for today. Zero Trust means never assuming that anyone is legitimate. Verify everything, every time. It fights ransomware, insider risks, and more while lining up with HIPAA and beyond. That awful situation in Germany shows the cost of trusting too much. A $10 million breach says that it's worth preventing. To get there, plan it out, train your crew, use tech, start small, track progress, and stay updated. It's a fortress for your data that keeps patients first. Thanks for listening again to the Medcurity podcast. We hope you'll join us next time. Stay safe, stay secure, and we'll see you then.